Okay, let's go ahead and get started here. The bone test is open now, and it'll be open till the 16th. And I wanted to do a review today using a very good study tool that I found a number of years ago, and I'll send you the link to it. It's out of the University of Loyola University of Chicago. It's called the Bone Box. And if you try to look for the Bone Box and just type that in, there's a variety of things that come up with that. But this is under, I'll send you the exact link for it. And hopefully I can get it to show up here. But it's a pretty good interactive study tool, and it covers most, not all, but nearly all the structures that we've looked at over the past several weeks, going over the skull and the axial skeleton and the appendicular skeleton. Doesn't cover joints and articulation, so you need to pay attention to that on your own. Now, the other thing is, if you are on the Sevier County campus and you want to go play with bones, the building, Maples Marshall Hall, the center building, is open next week on Monday and Tuesday. It's open every day, but it's open on fall break. And all you have to do is check in with campus police and they'll let you in. There's a cart in there with sets of skulls and arm bones and leg bones and several complete skeletons and a complete vertebral column, including a female pelvic girdle. So you can get a good chance to take a look at that too. So if you're in Sevierville and you want to stop there, if you go to the main campus, they may have something there available. The library used to have a skeleton available to study with in Morristown. So that may, if you are not a Sevierville student, and that's fine. I think the library in Morristown does have several skeletons available to use. So, okay, let me find out. First of all, anybody have any questions on anything? Okay, then I'm going to try to share the screen here and let me go. Open this up. Let's see if this works this way. Here we go. So everybody should be able to see this study guide called the Bone Box. Can everybody see it? So I'm assuming you're. Okay, good. Thank you. You know, or am I just talking to air? So,
I had my mouth full. I couldn't get the bite swallowed.
That's okay. I understand that. So, anyway, this is actually pretty good. So, for example, let's take a look at the skull over here, and we can look at the front of the skull, and it'll come up here, and it'll have these numbered structures on here. And I suspect that these are real skulls and not, plastic representations like we have. I mean, the ones that we have are very good models, and they're life size, but they're not as good as the real thing. So anyway, if you click on number 1, it'll tell you it's the frontal bone. Number 2 will tell you it's the nasal bone right here. Number 3, and I don't think we addressed this one, there's a big fissure there, and it won't be on the test if we didn't address it, but that is the inferior orbital fissure. So there's a big groove in there. It's not just about the optic nerve and some muscles and blood vessels. So, number 4, the zygomatic bone, forms part of our cheekbone. Number 5 is the maxilla. Number 6, the mandible. Number 7 is the one that everybody thinks is the mandibular foramen. Don't make that mistake. The mandibular foramen is on the inside of the mandible. This is the mental foramen. Just click on that. It says mental foramen. Here is one of the very first structures I pointed out to you, the infraorbital foramen, the foramen below the orbit, because this round thing is called the orbit. And that is the infraorbital foramen. And then number 9 here is the superior orbital fissure. Now that one does show up. You know, I've never put that on a bone test, and I probably won't start now, but maybe in the future I should. But that's that other opening that's right next to the carotid canal, not carotid canal, but optic canal that shows where the optic nerve comes through. You know, optic canal, optic foramen. It's that opening that occurs inside the orbit and comes out just above the sella turcica. So this covers a lot of the bones, looking at the front of the skull. A lateral view, classic side view here. We get to see the bones across the top of the skull. Number 1, of course, is the frontal bone. Number 2 is part of the sphenoid, because remember the sphenoid goes all the way through. It's that, you know, the flat bone right there, the end of this bone right here, right behind the orbit. That's the sphenoid bone, or greater wing sphenoid bone spine. 3 is the zygomatic again. 4 is the maxilla again. 5 is the mandible. 6 is the mental foramen. 7 is the coronoid process of the mandible. I never really addressed this a whole lot. You know, I wouldn't worry about it as far as testing purposes, or the head of the mandible. Mastoid process, we talked a lot about the mastoid process. We'll see when we get into muscles that the mastoid process is a point of attachment of some very powerful muscles that allow us to turn our head to the left or right. Number 10 is the temporal bone. 11 is the occipital bone. And 12 is the parietal bone. So we have, you know, it's a very quick way to review yourself here. You have your list of bones and you go through and say, well, that's number 1, what's number 2? You know, this is a lot more efficient than having a blank chart of the bones of the skull and a little diagram of it and trying to fill in and go back and keep doing it over and over again. It's a lot easier to do it this way. Posterior view, you get to see the suture lines. Here is the sagittal suture. Here, this is the lambdoid suture. Here we see the back of the parietal bone. We see the occipital bone here, and we see this is lambda now, but in the fetal skull, it's the side of the posterior fontanelle. So lambda is a term we never really addressed. So, you know, any of these terms, if I haven't addressed it, then don't worry about it. On the vertebrae, there's only 2 vertebrae that I ask you to know the names of, and that's the atlas and the axis. Cervical vertebrae 1 and 2. So there's the atlas. And of the parts of the atlas, there isn't much that I ask for on this. You should be able to identify it. 4, we didn't even address this list on the bones. That's where the occipital, this is where the occipital condyles rest, right here. And 6 is, yes, okay. So all you would have to be able to identify for the atlas is the fact that it's the atlas. That's all. We never really addressed the transverse foramen or any of those other things on this particular bone. So this is the atlas, and directly underneath it is the axis. Now the axis has one large defining property, and that's the dens. That's the structure that allows the head to pivot. The atlas sits on top of the axis. The skull sits on top of the atlas. The odontoid process projects up into the atlas, and that's the structure here, the dens or odontoid process. That is the axle by which the head turns. So again, be able to identify C1 and C2. C1 is the atlas, C2 is the axis, and the most prominent structure on here is number 1, which is the odontoid process, or what we've learned it as the dens. And then the other 10 cervical vertebrae, typical cervical vertebrae looks something like this. But if there are any vertebral questions, they're probably going to be off of thoracic or lumbar. The only thing that we would address here is the body. Most of these vertebrae have a body, and there's the body there and there. So, and this is the spinous process. Most of these vertebrae also have a spinous process. Well, let's take a look at vertebrae that you're more familiar with. There's a typical one that we looked at. This is a thoracic vertebrae. There are 12 of those, because there are 12 ribs and 12 thoracic vertebrae. But you should be able to identify number 1 as the spinous process, number 3 as a transverse process, number 5 as the body of the vertebrae, number 6, we didn't even talk about pedicles or we didn't talk about pedicles or laminas. Now this structure here, I wish this arrow was over on this side, because that is that superior articular surface that the vertebrae in front of this one would nest on. Remember how they nest? The inferior surface of the vertebrae in front sets on top of the superior surfaces of the vertebrae behind, and that forms the intervertebral opening. So if we look at this from this position, we can see, do we see it even better? Yeah, now we're looking at it from the other side now. This is the inferior surface here, and the superior surface, this is going to rest on top of the superior surface, but here is the body. Here is the body right there. Inferior surface. The superior surface will rest on top of that. Transverse process and spinous process. So what do you need to remember? Spinous process, transverse process, body, vertebral foramen. That's that big hole right here. Big opening right here is the vertebral foramen or vertebral canal. So you really only have to remember spinous process, transverse process. There's transverse. There is spinous, 6 up in the back. There's the body of the vertebrae right there. Let's take a look at lumbar and see if there's anything special that we need to see here. Again, spinous, transverse. There's the spinal foramen or vertebral foramen. That's where the spinal cord goes. Here we see the superior articular surface, the one that's pointed up, and the inferior process, the one in front of it, will set on top of that. So, and of course, there's the body. So there aren't a lot of things you have to remember. That most of these vertebrae all look the same. Most are going to have a spinous process. Most are going to have 2 transverse processes. They're going to have a vertebral foramen. they're going to have a body, and you get, spinous and transverse and body and vertebral foramen, and maybe the superior articular surface. I think I did a better job showing that in lab. And even this is not ideal. This is the, okay, yeah, there's the inferior articular facet. This is going to set on top of the superior surface. This is the inferior surface here. It's going to set on top of the superior surface, which is on the vertebrae right behind it. And so they're going to nest. And this little gap, notch in here is going to form one of the intervertebral foramen, where the spinal nerves come in from the side. Sternum. Here's our sternum. We have the jugular notch, which is right here. Well, they call it the sternal notch, but it's really the jugular notch, because that's where the jugular vein runs down behind it to get down to the superior vena cava for the heart. So that's the jugular notch. This is the clavicular notch down here, because that's where the sternum and the clavicle come together. But so number one is the jugular notch. Number two is the clavicular notch. Number three is the manubrium. They didn't change that around. Number four is the body. We use the term body a lot in here. And number six is the one that nobody ever gets wrong. That's the xiphoid process, the pointy end of the sternum. If you've ever taken a CPR class, you know what I'm talking about, because that's where they always, the instructors always tell you, never put your hands there. Always put your hands above the xiphoid process. The ribs are just ribs. There are 12 pairs of ribs. 1 through 8 are true ribs. 9 and 10 are 9, 10, and 11. 1 through 7 are true ribs. 8, 9, and 10 are false ribs because they attach indirectly to the sternum instead of directly. And 11 and 12 are the floating ribs. So you look at 8, 9, and 10, you can see that their hyaline cartilage attaches to the hyaline cartilage of rib number 7. All the ribs attach in the back. All 12 pairs attach in the back to the vertebrae, but only 1 through 7, the true ribs, and 8, 9, and 10 attach in the front. The floating ribs only attach in the back. Okay. So we don't really, it's a rib. So the scapula. This is one view of the scapula right here. This is the ventral surface. This is the side that rests down on top of the ribs. And so the first thing we see here that we've talked about, number 4, is the subscapular fossa. It is the flat area below the scapula, subscapular fossa. Number 5, we didn't even mention that, so let's go on to 6. The glenoid cavity or glenoid fossa, that's the socket where the humerus articulates. Number 7 is the coracoid process, point of attachment for muscles. Number 8 is the acromion, the counterpart, the flat end. This is the flat end of the scapula, and it will articulate with the flat end of the clavicle because there's the acromial process on the clavicle. You'll see that here in a second. So number 7 is the coracoid process. Number 8 is the acromion. Number 9 is the supra scapular notch, the notch above on the top of the scapula. Superior angle, down to the bottom is the inferior angle. This is the vertebral border because it's or medial border, it's on the side closest to the vertebrae. So what do you need to remember from this perspective? Acromion, coracoid, glenoid, subscapular fossa on this side. Let's take a look at the other side. Oops, I went too far. Let's go to the dorsal side. Okay, here we go. Now there's the spine. You know, number 10 is the spine of the scapula. So first thing I showed you when we went over this the first time in lab, I had everybody reach behind their back and rub the spine of their scapula. Everybody can find it. So there's the spine. The area above the spine is called the Supra Spinous Fossa. The flat area above the spine, right there, supraspinous fossa. And that means this flat area below the spine is the infraspinous fossa, because we use infra for below and supra for above. Here we see the acromion again. And we see, this is not, we didn't touch either on either one of those. So let's get down here to the inferior angle. Here is again the medial border over here, a vertebral border. There's the root of the spine. You just need to know it's the spine. There's the superior angle. And again, there's the supraspinous fossa. So, and it's, I emphasize the supraspinous fossa, the infraspinous fossa, and the subscapular fossa, because we start looking at the muscles. There are 3 muscles named after those bones. And if you've heard of the rotator cuff muscles and rotator cuff injuries, the rotator cuff consists of 4 muscles coming off the scapula. 3 of them, I've just shown you where they're located. The supraspinous fossa is the home of the supraspinatus muscle. The infraspinous fossa is the home of the infraspinatus muscle. And the subscapularis sits in the subscapular fossa. So what do you need to remember? Acromion, coracoid, glenoid cavity, supraspinous fossa, spine, infraspinous fossa, subscapular fossa on the backside, and that's about all we're going to cover. You know, I don't know if I've ever asked anybody. Maybe medial and lateral would be on there. The other stuff, the other questions, no. Clavicle. Number 8 is the acromial end. That's the flat end. The acromial end articulates against the acromion at the scapula. It forms part of the entire pectoral girdle. Here's the sternal end of the clavicle right there. And this, of course, is the body of the clavicle. You know, that's the 3 important things of the clavicle. You know, clavicle is a solid joint, you know, an immovable joint or slightly movable joint at the where it articulates with the sternum. It is a slightly movable joint at the acromial end of the clavicle, because we have give in that pectoral girdle that's made up of the humerus and the scapula and the clavicle, because we have that range of motion there. Okay. The humerus, well, we always remember that the head's always in the medial side. The head's always your landmarks. There's the head right there. We have the lesser tubercle. Remember, the lesser tubercle is on the same side as the head. The greater is on the opposite side. There's the lesser tubercle, and one of these is it's the neck of the humerus. Oh, there's the greater tubercle right in front of me. So in the greater tubercle, we'll see a similar arrangement on the femur. The greater tubercle is on the lateral side. The head is always on the medial side. So anything lined up with the head is on the medial side. So we can see there's the head right there. There's the lesser tubercle. It's on the medial side. And the greater tubercle is right there. So now we move down to the other end, we can see the medial epicondyle right here at 5. We know it's medial because it lines up with the head. Anything that lines up with the head is medial. So there's the medial epicondyle at 5. Number 8, its opposite number would be the lateral epicondyle. And this means that 6 and 7 are the trochlea and the capitulum. There's trochlea right next to the medial epicondyle, capitulum right next to the lateral epicondyle. The head of the radius articulates on the capitulum. It rotates around at the capitulum. And the deltoid tuberosity is right here, where the deltoid muscle inserts on the humerus. With the ulna and the radius, we can see, they're both very distinctive. Nobody ever gets those wrong. That round thing is the head of the radius. That's what articulates at the capitulum. There's the radial tuberosity there at number 2. And number 6 is the styloid process. So head of the radius, radial tuberosity, styloid process. Over here at the ulna, the olecranon process, the thing that looks like the socket wrench, coronoid process, and its styloid process down there. And, backside of it, again, number 6 is the styloid process. Number 1 is, they flipped it around. We're looking, this is the olecranon process. This is your elbow. The olecranon is your elbow. Over here is the head of the radius, the neck of the radius, and the radial tuberosity there. And number 5 is the styloid process there. So the head is what articulates at the capitulum. The olecranon rotates over the trochlea on the humerus. The hand, these are the phalanges. 1 and 2 are the phalanges. 3 are the metacarpal bones. And then the remainder of these are the carpal bones. So as far as the hand goes, phalanges, metacarpals, and carpal bones. I don't ask you to learn all the little carpal bones of the wrist. Now moving down to the pelvis. You look at the pelvis here. This doesn't give everything that we've talked about. It gives most of it. We'll start here at this side. We'll start over here. Here's the iliac crest, number 1. All the way across the top here. I know it's a superior iliac, it's not an iliac crest, the top of the iliac bone. Because the iliac is one of the 3 bones that make up the pelvic girdle. Number 2 is the part of the pubic bone. Number 3 is the ischiotuberosity. Essentially look for the ischium, because you have the ilium. This large, number 9 is the ilium. Number 1 is the iliac crest. Number 2 is the pubic bone, and number 3 is the ischium. Number 4 is part of the pubic bone also. Number 5, we're going to have the same name here. Pubic symphysis. That fibrocartilage that joins the 2 pubic bones together so that it functions as a shock absorber. Again, didn't address it. If we didn't address these, then don't worry about it. So this does show you that this is a female pelvis. Because notice that the pubic arch here is broad, shaped like an inverted bowl. This is a very broad and shallow bowl-shaped structure. If it was a male pelvis, it would be a very sharply defined inverted V. And this is not an inverted V. So, number 7 is the acetabulum, where the head of the femur articulates. Number 8 is still part of the iliac crest. And while this says it is the iliac fossa, this whole bone is the ilium. What they didn't label on here was the intervertebral disc here and the sacroiliac joint here, where the sacrum and the ilium come together. Again, that's where the shock of motion is transferred at that joint up the spinal cord and gets absorbed by these pads. Whereas this is the coccyx down here. This opening here is the obturator foramen that allows blood vessels and nerves to travel back and forth to our extremities. So, because our femur starts here at the acetabulum and comes down like this on either side, we have to be able to get blood vessels and nerves to and from the lower legs. And so they come down through the obturator foramen, this opening here. The posterior pelvis. So if you're looking at this from the backside, we do see a very nice illustration of the sacrum, and we see the spinous processes and all the sacrums. There's their intervertebral foramens there. There's the coccyx, sacrum, coccyx, ischium, ischium again. This is the greater sciatic notch right here. We call it a foramen, but it's still a notch because the sciatic nerve passes down through here, moving on down to all the way to the great toe. And then, oh, now they finally identified as the iliac crest. So, now, femur. The head of the femur, number 1. Now I'm recording all this, by the way, so you can, if you have a desire to watch this again, feel free. So there's the head of the femur. Number 2 is the intertrochanteric line, because we have trochanters instead of tuberosities here, or tubercles. So that means number 3 is the lesser trochanter, because it's on the same side as the head. And that makes number 7 the greater trochanter. So 1 is the head, 2 is the trochanteric line, 3 is the lesser trochanter, 7 is the greater trochanter, and 8 is the neck of the femur. And that's where most hip fractures occur, right across the neck of the femur, especially in older people, because the compact bone on the surface of the femur is the only thing holding it together. The large amount of spongy bone underneath actually gave it its strength and support has been easily worn away with osteoporosis. And so that's why you just have this thin outer shell at the neck that breaks. At the lower end, we have the medial condyle, same side as the head. The lateral condyle here, this would actually be the medial epicondyle with a lateral epicondyle over here. So this is our shaft of the femur itself. Let's look at the back side of it. Now we have, again, we have the greater trochanter and the lesser trochanter. Number 1 is the greater trochanter. Number 2 is the lesser trochanter. Number 3 is we never mentioned that. Didn't bother to mention that either. The lateral condyle down here. Popliteal surface, there is a artery and a vein that run up and down behind the, I'll just mention it, don't worry about remembering it right now. We'll talk a lot about that in AP2 when we talk about blood vessels, but there is an artery and a vein that run down, up and down behind on the posterior surface of the leg. It's called the popliteal artery and popliteal vein. So popliteal vein is often a location of blood clots from deep vein thrombosis, a clot that may form from an obstruction in one of these veins. We call them a DVT. Okay, so lateral condyle, and then this is the medial condyle because it lines up with the head of the humerus. Remember that when you're looking at a picture like this, that the great toe is always on the medial side. The head of the femur is always on the medial side. The fibula is always on the lateral side, and the tibia is always on the medial side. So medial side, head of the femur, tibia, medial condyle, and big toe. Tibia and big toe, all the way up and down. If we were in class and you looked at the skeleton, you could just look right up and down the leg. The same applies with the leg models for muscles. The big toe is always your landmark, telling you it's always on the medial surface. So anyway, lateral condyle, intercondylar notch. I think we saw that. Medial condyle, and these two. This is the medial epicondyle and the lateral epicondyle over here. Remember that the condyles go up, essentially up and down, and the epicondyles go side to side. And the condyles of the femur are going to set on those meniscus pads that are found on top of the tibia. 10, neck of the femur, and then 12 is the head of the femur. The tibia and fibula. Okay, the fibula, the most useless bone in the body. The only thing we can remember about the fibula is that the distal end of the fibula forms the outside of the ankle structure. It forms the lateral malleolus. That's the portion of the the ankle that you can feel on the outside, on the lateral surface of your foot. So the lateral surface of your foot at the ankle joint, is your lateral malleolus. That's your fibula right there. The medial malleolus is from your tibia. The tibia does all the heavy lifting. Remember, the fibula is only attached by a couple of ligaments to the talus and to the tibia, and it's also attached by one ligament to the femur. It's not a load-bearing bone. It doesn't do anything. In fact, that's a site of very common injuries. Because it's a weaker bone, our foot tends to roll over at the side of the fibula. A sprained ankle involves rolling the foot over on its side and tearing those ligaments that are holding the tibia, holding the fibula to the talus or calcaneus, or to the tibia itself. But there is no such bone as an ankle bone to break. So a fracture at the ankle would involve fracturing the tibia or the fibula or the talus. Over here is our tibia. Here's the head of the tibia, the tibial tuberosity. These are all points of attachment. This is the anterior crest of the tibia, that sharp edge that you feel on your leg. We identify it as our shin bone. It's really the anterior crest of the tibia. And here is our medial malleolus. That is the inside portion of the ankle. You can reach down and feel that on the medial side, on the big toe side, and that is the end of your tibia, the medial malleolus. Tibia is the bone that does all the heavy lifting. It's the load-bearing bone for us. We very rarely roll our ankle to the inside. We very rarely roll our foot to the inside. We would nearly always roll our foot over to the outside because that's the weaker side. The fibula is the weaker side. let's see, we see the posterior surface here. Apex, head of the fibula, neck of the fibula, lateral malleolus. I will tell you on the models of the fibula that we have, it's very hard to distinguish between the head and the lateral malleolus. So, you know, don't expect a lot of questions on the fibula other than what bone is this and what is this structure down at the bottom. I'll just give you a hint on that. Here's our tibia. Let's see. Popliteal line of the tibia. More than likely, that's where the location for this artery and vein run down. Without thinking back to where blood vessels are going, that's my educated guess on that. So, and then down here is the medial malleolus. So, tibia, anterior crest of the tibia, the medial and lateral condyles of the tibia, the medial malleolus, and I said, like I said, the anterior crest, and for the fibula, be able to identify the fibula and the lateral malleolus. And that brings us down to the foot. So we're looking at the dorsal surface now. All at number 9, these are all phalanges. Same name as we have with the fingers. The bones behind the phalanges are the metatarsal bones. You know, there are 5 of them, just like there are 5 metacarpal bones. Behind the phalanges are a series of tarsal bones. This first one is the first cuneiform. The second one is the intermediate cuneiform. The third one is the lateral cuneiform. And they all share the same last name. First cuneiform, second cuneiform or intermediate, and third cuneiform or lateral cuneiform. Behind the cuneiforms, we've got the navicular and we have the cuboid. Those are the tarsal bones. The reason I ask you to remember the tarsal bones is because there are only 5 and 3 of them have the same name, you know, cuneiform. Behind that, you have the calcaneus, which juts out to our heel. It's our heel bone, if you will. That number 7 is the calcaneus. That is the bone that the Achilles tendon attaches to. The Achilles tendon is what, by pulling on the calcaneus, gives us the ability to raise or lower our, raise our heel or raise or lower our heel. Raise our heel, lower our heel. Put the heel down, bring the heel up. We can't walk without doing that, at least not very well. So number 7 is the calcaneus. 6 is, you can't really see it well here, but 6 is the talus. The talus juts up above the calcaneus, and the medial and lateral malleolus form on either side of it. Give you a better perspective here. Here we see phalanges, more phalanges, metatarsals, more metatarsals. So this is the cuboid bone. This is the navicular back here. And 9 and 10 are cuneiforms. This is number 10 is the lateral cuneiform, or lateral cuneiform. Number 9 is the intermediate cuneiform. Number 2 here is the lateral malleolus. This is the fibula right here. Number 3 is the calcaneus bone here, jutting out back to form the heel. The talus, you just can see part of it jutting out there. Number 1 is the tibia forming the medial malleolus on the other side there. So they the talus is nested on either side of it, on its lateral side by the fibula and on its medial side by the tibia. The lateral side of the fibula is forming the lateral malleolus and the tibia is forming the medial malleolus. And was there? No, nothing. We already didn't see. Okay, so those essentially are the bones. So now I'm going to send you this link, and you can go back and go over this as often as you like and quiz yourself. Use our names for anything here, because that's what you're going to see in the test. The test is going to be multiple choice. It'll all be images. It'll be everything should be highlighted either with an arrow. I don't think I have any structures that are highlighted with colors, but there might be usually arrows going to everything. And I'm sure eLearn will have its little errors there. eLearn loves to jumble, as I think we saw on the first lecture test. They like to jumble questions together. So now there's at least one question that had two other sets of answers embedded in it. Sometimes eLearn will jumble 5 or 6 questions together into one. So you just never know what's going to happen. That's why I'm always willing to go and review exams. So anyway, let me get out of the sharing part here and ask, is there any questions? Okay, I am going to, oh, go ahead. Was there a question?
Yeah. What all do we need to know for the lecture test that's coming up?
Oh, the lecture test, that'll be lecture test 2.
Yeah.
Well, it's going to be on cells, and it's going to be on nutrition and metabolism. And we haven't finished the metabolism portion yet, but we will probably next week. And I'll probably have to slide the date of the test back here. But you'll, for the cells, you'll have to know the structures in there, and there'll be a fair amount of emphasis on transcription and translation. I'll probably give you a set of nucleotide. I'll give you a set of bases, and I'll say, what's the complementary copy for this on DNA or on RNA, something like this. So I give you, CG, AATT, or whatever, complementary copy in DNA, complementary copy in RNA, something like that. Stop codons, different things along those lines. Cell structures, what do they do? What does a ribosome do? What does a mitochondria do? Anything I've put a lot of emphasis on, like probably 1 or 2 questions on Tay-Sachs. As far as chapter 24 goes, right now, it's, I can tell you there'll be questions on vitamins and on on the 3 major organic molecules that we use. And then there'll be questions on oxidation and things like that. We haven't finished that chapter yet, but off the top of my head, that's sort of how the test is going to be organized. I hope that wasn't too vague. Okay. Any other questions? Okay, then I'm going to get us out of here. I'll go ahead and post this video and give you the links. You can go back and play with that bone box as much as you want. So, and of course, there is no lab next week. All labs next week are canceled because I don't want to get us off track.